Hello everybody, I'm back with a new video, just checking in with you guys. So much has happened since the last time I did a video. I was at urgent care on Tuesday. I was having lower back and pelvic pain. And I mean, this was like really severe to the point where even moving or walking, the pain would become so excruciating. But I decided to go to urgent care just to make sure or just to see what was going on. Like I said before, you have to listen to your body. If something don't feel right, you have certain symptoms or um, something is just not normal, you want to go get that checked. So, they did a CT scan, they did an X-ray, they did a ultrasound as well. And I got my COVID test done, which is negative. Um, but I also had vomited on, I think it was Sunday. No, it's actually Monday. And usually when I take my tacrolimus, which is a immunosuppression drug for my heart, usually I don't have any issues with feeling nauseated or anything. I'm able to take it on an empty stomach. So that particular morning on Monday, it wasn't no different from my routine, which I take it at 8 a.m. in the morning. So when I took it, I didn't have anything on my stomach. So about 5, 6 minutes later, I start to feel sick. So I was like, oh my God, I feel like I'm about to throw up. So I went to the bathroom and I did throw up. Um, then my stomach was acting up. And so I was like, ooh, this is not normal. And then out of nowhere, the pain started in my lower back and my pelvic. So back to what I was saying, they took all these tests, did all these images, um, and so I don't want to disclose what happened with that, but when it comes to everything, I'm gonna have to get surgery. And I'm not the type of person, I don't want to get cut again. I've been cut, I feel like, too many times, one too many, and I actually had 2 heart surgeries. So having to get major, I don't want to say it's major surgery, but it is surgery where I would have to get cut. I would have to stay in the hospital, and I just don't feel comfortable with that. Um, I'm trying to remain strong. I'm trying to mentally prepare myself, emotionally prepare myself. I just don't like being in a hospital. I don't like being away from my son. I already, jumped over a hurdle with my last hospitalization. Sorry, with my last time being admitted to the hospital, I was in there over a month. Not saying I'm gonna be in there over a month, but when I have made it through a big storm and I'm getting back to my body, becoming 100% better. And, I'm starting to feel a lot better. I'm starting to have more confidence and, knowing I can walk a certain amount of distance and not feel like, oh my God, like I'm short of breath, I'm gonna pass out. So I'm feeling good about my lungs and them recovering from my last hospital stay. My heart definitely was okay, thank you God. Um, but you know, I just don't want to go through that. Um, and of course, this takes me away from getting back into the flow of work. I don't know how long I'm gonna be down or um, the recovery time post surgery. So it kind of sucks. Um, and I just want to hurry up and like get this over with, you know. Um, my care team, the cardiologist, um, the Coumadin clinic, because I take Coumadin for my blood to make sure I don't have any more blood clots. Um, like just a whole team have to converse and get this prepared because I am a complicated patient with all that is going on health wise with me. So they want to make sure that I'm in good hands. They want to make sure the surgery goes well. And I can respect that. That's fine. They do have me on pain medicine. But for me, it's kind of like I don't want to have to keep taking pain medicine, you know, and when I can just go ahead and just get the surgery done to relieve the pain. Um, so those are my feelings and thoughts on that. Um, I didn't expect to hear that information when I went in there. I thought it would be something totally different, but you know, as they say, sometimes life throws you a curveball, and it's all about how you deal with it, you know. For me, it's just like one of those things, like I explained before, like I don't always actually sit back and think about like everything I've been through. I don't really give myself enough credit when I've made it with the help of God, with all of God really, but for Him giving me the strength and me not giving up, continue to move on, being a single parent. And it's like I don't give myself enough credit, you know. And I don't know, it's just hard to do that because my brain is wired like, okay, that's what I'm supposed to do. I'm supposed to get through it, be strong, because I got a son to take care of. I got things that I want to accomplish. I can't not handle business because it's more than just myself. So, when people say, you know, you've been through so much, you're so strong, it kind of like, I hear it, but it's like, okay, that's what I'm supposed to do. You know, it's not like, okay, I have a choice not to be strong. I have to be strong. And I think that kind of like messed up me really processing things. Um, and just dealing with that emotional side. But other than that, you know, I'm doing great as far as, you know, my heart. They did find a little bit of fluid in my lungs, but I need to continue to take my Lasix, um, which is a medication to remove fluid, unwanted, and extra fluid out of your body. So that right there, and I don't know. That's all I've been up to. I just wanted to keep you guys updated. And definitely when I go, before I go into surgery, um, when they do admit me, I'm going to post the update for you guys. Just to let you know how my spirits are going into pre-surgery. And I will post a video post-surgery, not right away. It's going to be some days because I know I'm going to be in pain. And yeah, so they also want to make sure that they send me to a really good hospital. Um, who would specialize in this type of surgery. They want to send me to Virginia Hospital Center, which I'm cool with. I just don't want to go to Washington Hospital Center. I think more so at Washington Hospital Center, I had some bad experiences there with the staff, the nurses. So I want to go somewhere where I'm able to be calm, zen, have peace, that I don't have to, go back and forth with nurses. I feel like it's just unnecessary, especially when a patient knows their regimen, they know their routine, they know their body. So I'm not going to allow somebody to just do whatever they think, feel necessary. I ask questions when they was giving me my medication in the hospital. I asked them what medication is that, because at the end of the day, I always say you have to be your own advocate, and you got to stand up for what you feel is right. You got to make sure you're being well taken care of. And so for me, I had my family there advocating for me, and I advocated for myself. But if nobody else advocates for you, remember you have to advocate for yourself, because you're the one who's going through this and experiencing this. They may say, I understand, I've dealt with other patients, but you have to respond to them. You haven't dealt with me. I'm not the same as your other patients. Okay? So I think for me, I just really wanted to go. I want to go to Virginia Hospital Center. So they're getting everything, worked out. So while I'm waiting, I'm going to just relax my mind, meditate, pray, read my Bible, continue to push forward, continue to be grateful for every day that God wakes me up, continue to be grateful that I'm a mother and my son loves me to death. What are you eating? Nuggets? Alright, Kingston, don't talk with your mouth open. And, continue to live my life, continue to accomplish goals, continue to be an inspiration to people, continue to tell my testimony, continue to do these videos, whether it reach one person or 10,000 people. I just know that it's therapy for me, but also at the same time, it's me giving back to people who are going through what I've been through, transplant survivors, So if you guys, anybody, you want to comment, like, share, subscribe to my channel, I really appreciate all you guys, and I love you, and I thank you for allowing me to express myself, my journey, my testimony through this 4 years, well, a little bit more than that, 6 years, going on 7 years, having heart failure. So it is time for me to get some sleep. And I want to thank you guys again. I love all of you. God bless every single one of you. And I will be back with another video pre-surgery to let you guys know what's going on and just to check in with you guys. So everybody have a great night. And Keep me in your prayers as I will keep all of you in my prayers. Thank you.